Good day and welcome to the presentation on healthy coping and the dangers of unhealthy coping. This video has been created by the Department of Student Counseling at Cape Peninsula University of Technology. This video will provide information to help you understand your choices for effectively dealing with life's challenges, and it will equip you with critical life skills. So, to start off, successful coping is a vital human behavior since obstacles are part of life. The truth is, no matter how great your life may be, you will eventually deal with disappointments, setbacks, failures, and even loss and trauma. Each and every person in the world must face difficult situations, and everyone must come up with effective ways to deal with and bounce back from these situations. So, to start off, it is helpful to consider the specific challenges that students face. The idea that the emerging adult is neither an adult nor an adolescent is not a new concept. We face significant challenges prolonging that move from dependence to independence. Social and economic forces with significant role and developmental challenges have prolonged entry into adulthood beyond the traditional adolescent years. So, the common challenges students face in the personal area are physical problems or impairments, access to resources, social issues, and transitioning through adolescence to adulthood. Common challenges students face in the relationship area are family difficulties, financial difficulties, and managing relationships. Common challenges students face in the environmental area are access to resources and continually changing nature of the university environment. The common challenges students face in the university related or academic area are high academic expectations, rigorous class schedules, the integration of classroom and clinical learning, tests and examinations, the amount of classwork and poor grades, time management, clinical fieldwork, relationships with supervisors, amongst others. Challenges in recent stresses and adverse childhood experiences such as bullying, emotional abuse, physical abuse, and neglect increase the risk of mental health problems such as depression and anxiety. Being the first to study in the family also places a lot of pressure on individuals. Challenges a student could also face is recent trauma exposure and the effects of accumulative stress, which could result in psychopathology. Documented differences exist in terms of gender, program of study, and year of study on the effects of stress and management thereof. So, stress is critical for our survival. Without stress, we would not be bothered to study for an exam or to get out of bed in the mornings to get to class. However, prolonged stress can be damaging to our bodies. Stress is adaptive when we perceive opportunity in the challenges presented in the environment. We see ourselves as being able to manage and possibly reap benefits from the situation. Stress is maladaptive when we perceive internal or external demands of the environment to be threatening to our well being or survival. Threats are not only in terms of physical danger, but also when our sense of self, our identity, our worldview, and our inner beliefs or faith seem endangered. We perceive our resources and ability to cope as being outweighed or overwhelmed. So, for example, dealing with a romantic rejection, dealing with the loss of your partner, the more serious the threat, the more effective the coping must be. So, what is coping? Coping refers to cognitive and behavioral strategies that people use to deal with stressful situations or difficult demands, whether they are internal or external. Coping involves conscious and deliberate engagement in personal and interpersonal problem solving. And when coping is successfully managed, it builds resilience and improves tolerance for distress. So, coping is proactive, it reduces stress, and it aims to neutralize a future stressor. Successful coping then builds resilience, which refers to an individual's capacity to adapt to change in a healthy and flexible way during stressful events. So, resilience is measured as internal adaptation, so that's like your happiness and your self concept, or external adaptation, which is your academic achievements, for example, to adverse circumstances, such as how well a person navigates and achieves the developmental tasks presented by the external world. So, in contrast, when we engage in strategies that increase stress, this may be defined as non coping or maladaptive coping, which is reactive. So, there are important dimensions of coping. Namely, we'll be looking at internal, external demands, coping mechanisms versus defense mechanisms, and then coping styles and healthy and unhealthy coping. So, we'll be looking at all of these briefly. So, sometimes we need to cope with things that happen to us. So, for example, maybe having your wallet stolen, that is an external demand. It's a stressful event that has happened to you. You have to then find ways to cope with the challenges of the situation. Other times, we must cope with things that happen within us. So that's like maybe dealing with depression. There may not be a traumatic event, but you have to address the internal challenges that's being presented by the depression. Some events may require us to deal with both the internal and external demands. For example, you may lose a friend and are depressed as a result. Coping skills are not neatly divided into internal or external demands, and effective coping can cover a wide range of challenges. Both coping and defense mechanisms are processes used to alleviate anxiety or to manage a situation that is creating problems for you. Coping mechanisms are typically conscious and intentionally applied, while with defense mechanisms, they operate on the unconscious level and helps us to ward off anxiety that's arising from unacceptable or potentially harmful stimuli. So, defense mechanisms may result in healthy or unhealthy consequences, all depending on the circumstances and frequency with which they are used. So, an example of a defense mechanism is denial. So, denial is a way of not seeing something that is right in front of you. Defense mechanisms are normal and natural. They are often used without any long term complications or issues. However, some people do develop emotional difficulties if they continue to use these mechanisms without coping with the underlying anxiety. It is healthy to learn to address issues from more of a mindful place and not an unconscious one. So there are two main types of coping styles. There's the problem-focused coping style and then the emotion-focused coping style. So with a problem-focused coping style, it is an active style of coping which focuses on the problem itself. So it attempts to tackle the root cause of your distress. It's aimed at reducing the demands of the situation or stressor by expanding the resources for dealing with the stressor. So, problem focused strategies and positive thinking methods of coping are considered to be adaptive coping strategies which reduces stress. Then you get emotion focused coping style, which is an avoidance style of coping. It focuses energy on dealing with the feelings rather than the problem itself. So, emotion focus may seem like you ignoring the problem, but this is an important tactic because when we cannot influence the situation that we are in, it is important then to focus on the things that we can control. Things like how we react, that we can control ourselves and our responses to what is happening to us. So the individual may feel better after using this coping style, but the problem is still not solved. So, depending on the situation, a particular coping response may be effective for some individuals, while it may be detrimental to others. So, now we will look at healthy versus unhealthy coping. So, with healthy coping, it lessens stress, it increases our well being, it builds our capacity for problem solving, and it results from a changed perspective or a reframing of the problem to identify opportunities within that situation or problem. So, healthy coping requires maturity. It requires acceptance of our faults without blame or shifting the blame to others or self blame. It improves our tolerance and increases our capacity for turning the negative into a positive. With unhealthy coping, it could come from any of the previous categories, but mostly from attack, avoidance, defense, or self harm. Unhealthy coping is a way of definite dealing with problems and may help in the short term, but create stress and anxiety and damage self confidence in the long term. It is possible to come out of stressful and difficult situations with greater ability to deal with stress and enhanced capacity for turning the negative into a positive. So, to speak a little bit more about the dangers of unhealthy coping, I think it's important to then start with just the prevalence of substance or medical use within South Africa amongst our students. So, an estimated 13.3% of South African population has used drugs during their lifetime, resulting in resulting in substance abuse in 3.9% and dependence in 0.6% of the population. Among university students, research suggests that alcohol, cigarettes, and cannabis were found to be the most commonly used. In another study of students, about 50% of the sample reported that they drank alcohol 2 or 3 times a day. In this study, 10% of males and 9% of females self reported risky or harmful levels of alcohol use. These findings were related to significant levels of self reported stress and a perceived lack of control of events in these students' lives. When students use alcohol in order to cope with emotional distress, there is a potentially a greater risk of them developing alcohol use disorder or dependence. So, alcohol use disorder is reportedly the most prevalent psychiatric disorder among those who are aged between 18 and 34 years. There has also been reported that there's an increase in the use of OTC and prescription medicines such as codeine based cough syrup, and students may be under the impression that through the use of psychostimulants, they will enhance their concentration and ability to study. And then, even when it has not been described to them by medical practitioners, it's still being abused. So, the negative effects of or substance use include absenteeism from classes, a decrease in academic performance, increased dropout rates, and loss of interest in daily life. University students consume substances for a variety of reasons, including personal pleasure, releasing tension, and to cope with work pressure. The use of substances as a way of coping is often time consuming. It often comes with also a great financial cost. And over time, the substance is often needed in larger amounts for the person to get the same original effect. The person may feel sick or uneasy without access to the substance, and the use of substance may result in the neglect of responsibilities and important activities related to one's work or social life. It may cause or worsen interpersonal problems, and it has the potential to cause or worsen psychological or physical health problems. It is also often dangerous in that it exposes the person to risky situations or it can place the person at risk for harm. Substance use may lead to death through overdose as well. So, if you feel that you can actually relate to any of these points just mentioned in the context of your own relationship with a substance or medication, it may be a good idea to consult with a medical or mental health professional. So, students attending university for the first time experience a totally new environment full of significant social and cultural changes, as well as intellectual challenges. Peer pressure, the desire to experiment, and the absence of programs to combat drug abuse and raise awareness of its dangers can all contribute towards the tendency among students to turn to drugs or substances. Using substances as a means of relaxation, stress relief, and increased performance is facilitated by the easy availability of such substances around campus, and in some cases, the lack of alternative recreation activities offered by universities. So, now we'll talk a little bit more about self harm. So, when someone hurts themselves without intending for death to be the end goal, they're engaging in what's known as non suicidal self injury or self harm. So, cutting is the most common form of self harm. Other forms of self harm include burning, pinching, and scratching of body parts, head banging, self poisoning, or hitting. Socially accepted behavior, such as body piercing, is not considered self harm, and self harm is often and easily misunderstood. So, cutting and other forms of self harm can be understood as a form of coping. It is sometimes used as a way of coping with negative events or feelings. For many, instances of self harm are preceded by an interpersonal internal event, such as having specific thoughts or feelings. So, people who self harm may have difficulty understanding or expressing their emotions. They may not have had the opportunity to learn how to cope in a more productive way. Negative behavioral dispositions and emotions associated with self harm include hopelessness, disappointment, loneliness, stress, sadness, guilt, embarrassment, aggression, shame, self hate, anxiety, low self esteem, impulsivity, and depression. Self harm can sometimes be associated with mental health problems, including depression, anxiety disorders, personality disorders, and bipolar disorder. People who cut themselves may be trying to cope with emotional turmoil. It may offer a distraction from those difficult feelings. And self harm can be a way for a person to feel something when experiencing numbness or a sense of being outside of themselves. Some people they self harm in order to create a wound symbolizing their emotional pain. Deep seated and unresolved feelings of rejection and loneliness and self hatred and anger or confusion may be present. So, self harm can also be a means of self punishment for perceived shortcomings or failures. People who self harm at times describe a specific type of high or relief or sense of connectedness or sense of calm related to the act. The euphoria described by some may be attributed to endorphins the body releases when we get injured. Many people who self harm repeatedly do so with the expectation of relieving an interpersonal difficulty or a negative feeling, or of inducing a positive feeling. By any relief offered by self harm is all short lived, while for some it may be followed by feelings of shame or guilt. Others may report that it does not cause distress or interfere with their functioning. Self injury is not typically associated with suicide, yet it can lead to severe or even fatal injury. Research has shown that when a person thinks about self harm over a long period of time, the type of self harm that they engage in will be more severe, and the consequences will also be severe. Finding new ways of coping with difficult feelings can help to suppress the urge that leads to self injury. Focusing on identifying feelings and then challenging the thoughts that lead to self injury can be helpful. So, seeking outside professional assistance or engaging in individual therapy may be a good idea as well. Stopping is easier if you can find other ways of expressing or coping with your feelings. So, here are just a few positive coping skills that you can try it for yourself, and see what interests you the most. So, you could write, draw, or paint, or take photos, play an instrument, sing, dance, take a shower or a bath, take a walk or go for a drive. You could clean or organize or take a break. You can set boundaries and say no. You can do volunteer work, deep, slow breathing. You could pray or meditate or write in your journal. Here are some negative coping skills that you can maybe try and avoid. Um, so, here are some examples. Could be procrastination, abusing a drug or alcohol, both blaming others and blaming yourself, self harm, stubbornness, eating too much, gambling, letting others take advantage of you, self sabotaging behavior, being violent towards others, or overgeneralizing. While dealing with stress and pain and suffering is unavoidable in this life, being dragged down by these situations is not. Believe in your own ability to deal with the stress. Give a couple of these coping mechanisms a try and see if you can turn a negative situation into an opportunity for positive growth. The way we cope may feel natural to us, even in cases where it might be doing us harm. It may feel ingrained so much so that it's a part of us that is set in stone and it's unchangeable. It may also feel too useful to be able to do without it. But despite this, it is possible to change the way in which we cope. It is important to note that no matter how we cope, it is our own unique attempt to put things right and to regain our balance. If someone were to separate us from our usual ways of coping without cultivating other forms of coping, we would be left vulnerable and easily overwhelmed by life stresses. So, in order to make changes, we would then need to be patient with ourselves. We might need some help and support. So, it's likely to take some time. We often learn best when we are in the company of supportive others. So, we are aware of how challenging this recent time has been, especially for students. So, Therefore, we encourage you to make full use of this opportunity provided through this video. And please be aware that you can contact us via email at student counseling should you feel like you need further support. Um, you can email us on studentcounseling@cput.ac.za. So, lastly, to end off, I would just like to say thank you for listening and taking our time to watch this video. And I wish you all the best on your endeavors moving forward.